Welcome to our presentation on magnet recognition. During this presentation, we will discuss the definition of magnet, the magnet model, how magnet affects patient outcomes, how magnet affects recruitment and retention, the magnet application process, the pros and cons of magnet, and magnet leadership roles and responsibilities. What do we mean by magnet? Well, the American Nurses Credentialing Center, or ANCC, defines the Magnet Recognition Program as one that recognizes outstanding organizations for superior quality in nursing and patient care. In order for an organization to obtain magnet status, it must have top scores in the areas of clinical outcomes, patient satisfaction, and nurse satisfaction.
This part of the presentation is focusing on the magnet model. This is the framework for hospitals to follow when they apply for the magnet status. It is based on the American Nurses Credentialing Center, otherwise known as the ANCC. There are 5 different model parts that a magnet hospital must have. In 2008, this was narrowed from 14, and overall, again, the outcome is the most important part. The first section is transformational leadership. Nursing leaders must demonstrate a support for the staff and patients to transform values, beliefs, and behaviors. Your CNO must have influence over other executive stakeholders, the board of directors, and trustees. Nursing's mission, vision, values, and must be the same as the hospital's in order to improve performance. Programs in place are used and evolved evidence-based practice, and the nurses' voices should be heard, their input be valued, and their practice supported. This is how a magnet hospital receives top scores in nursing satisfaction, is when they feel like that they're being heard and listened to, and that their voice is important. That will help dictate good patient clinical care and good patient outcomes. Structural empowerment. Nurses are involved in the shared governance and decision-making process to establish standards of practice and address areas of improvement. Nurse leaders serve on decision boards that focus on excellence in patient care and the safe, efficient, and effective operation of the hospital. Nurses in leadership form a strong partnership with leaders to improve patient outcomes. So that the nurses and nurse leaders work together, not only within the structure of the hospital, but also doing outreach programs in the community, so that way everybody works on the same plane. This not only improves patient outcomes, but it provides a healthier lifestyle for the community as well. This is done with strategic planning, structures, systems, policies, and programs. The next one is exemplary professional practice. The nurses work with patients, families, support staff, and interprofessional teams to positively impact patient care and outcomes. The hospital values a collegial working relationship within and among all disciplines. Nurses work with other disciplines to ensure that the care provided is comprehensive, coordinated, and monitored for effectiveness. And nurses also have data based on their satisfaction scores and clinical outcomes versus other hospitals across the country. And it's also been shown that magnet hospitals generally have better outcome scores than non-magnet hospitals. So basically what this is that nurses, the physicians, pharmacists, even down to the housekeeping staff, they all work together to be a cohesive group. New knowledge, innovations, and improvements. This is integrating evidence-based practice and research into clinical and operational processes. Nurses are trained to use evidence-based practice to ensure the safest and best practices for the patients and to gain new knowledge. This established new ways to achieve high-quality, effective, and efficient patient care. Empirical outcomes. Empirical measurement of quality outcomes related to nursing leadership and clinical practice is imperative. Magnet-recognized hospitals are graded on clinical outcomes related to nursing, workforce outcomes, patient and consumer outcomes, and organizational outcomes. Basically, this is the most simple way of demonstrating excellence.
It's no secret that patient outcomes is an important metric for determining the quality of care at any kind of facility, and magnet hospitals are no different. The government has increased its emphasis on patient outcomes in the form of recognition and reimbursement. So being able to provide high quality patient outcomes is beneficial to both the patient and to the hospital. Also, patients are able to recover and return to their normal life, and hospitals are able to also show that they have a commitment to high quality care, which in turn leads to increased earnings and the ability for administrators to market their facility. Magnet designated facilities have been found to also have improved patient outcomes in many areas. This designation is attractive to patients when considering their healthcare options. When it comes to magnet designated hospitals and affecting high quality patient outcomes, a big emphasis is placed on using evidence-based practice. And this is important because magnet recognized hospitals, they don't specify nurse staffing levels or education or any kind of specialty certifications for any of their bedside nurses. Instead, they choose that the program requires evidence-based processes aimed at organizational reform of nurses' work environments in relation to desired patient outcomes. And all this is put together in order to affect better patient outcomes. New knowledge must be transformed into clinically useful forms and measured in terms of meaningful impacts on performance and health incomes, and all of this adds up to better patient outcomes. Continuing on with evidence-based practice and patient outcomes, magnet hospitals recognize that evidence-based practice holds great promise for moving care to a high level of likelihood for producing the intended outcome of getting our patients to feel better. This component of exemplary professional practice involves interprofessional collaboration in addition to working with patients and families, and all of this is used to achieve these high quality outcomes. Also, magnet recognized hospitals continue to demonstrate better outcomes, and in the case of one study, it showed there was lower surgical mortality rates as well as lower incidences of having a failure to rescue. Their better outcomes could be attributed in large part, although not entirely, to investments in the highly qualified and educated nurses, as well as the practice environments that are supportive of these high quality nursing care. Looking at patient outcomes and magnet designation, specifically looking at more of the statistics, across the 13-year study period, patient outcomes were found to be significantly better at magnet hospitals than in their non-magnet counterparts. Surgical patients treated in magnet hospitals compared to those treated in non-magnet hospitals were 7.7% less likely to die within 30 days. Patients treated in magnet hospitals were also 8.6% less likely to die after a post-operative complication than patients treated in their matched counterparts. One thing to remember, though, is the outcomes did not improve for hospitals after they received their magnet recognition, and some people could argue that this suggests that the magnet program recognized existing excellence, although it may not have led to additional improvements in these surgical outcomes.
So moving on to the next part of the presentation, I'm going to be discussing recruitment and retention in magnet versus non-magnet hospitals. Just to begin, over the past several years, there have been many studies and many documented cases of lower turnover rate in magnet hospitals versus non-magnet hospitals. Some of the reasons behind that include managerial support, adequate staffing, and the incentive to continue education, all things which are part of the magnet concept. So this is really important for us as nurses because obviously we want to be working in some place that we enjoy working, that we feel the support, and that we want to come back to work every day. And that's a large part of retention factors. As far as incentive to continue education, magnet hospitals often offer career ladders and advanced certificate programs, as well as tuition reimbursement, which is a pretty important part, especially if we choose to continue our education. So just a couple of studies that I was able to research that show the importance of the magnet hospital retention and recruitment rates. This study that was conducted in 2011 was a survey mailed out to a ton of different nurses in various different states. They wanted to kind of get an overview of different areas of the country because as we all know, working in a city hospital in Philadelphia is much different than working in a suburban hospital in California. So the idea of this was to really get a broad spectrum of magnet and non-magnet hospitals. The surveys were mailed out to a ton of different nurses, and when the results were tallied, it was proven that magnet hospitals had a significantly better work environments, and they also had a higher level of education among nurses, mostly because the magnet hospitals usually require a bachelor's of nursing in order to work on the floor, whereas the non-magnet hospitals can be diploma or associate's degree nurses. So magnet hospital nurses were 18% less likely to be dissatisfied with their job and 13% less likely to report high burnout, which again is a really important aspect since we all know that burnout is a pretty big concern for nurses, especially on the floors. And we all want to be happy with where we work. You know, that's what makes us come back to work day in and day out. And if we're more happy with our jobs, we'll obviously stay there longer. Finally, one of the big aspects of the magnet hospitals, which is very important to me as I am a fairly new graduate as well, is the residency program designed to help new graduates enter onto the floor. So a typical new graduate training is 1 to 3 months, which may sound like a lot of time, but depending on how your nursing school was, run, it can feel like it's not enough time. I personally didn't have a lot of clinical experience in my nursing program, so it was really important for me to get into a graduate residency program. The magnet status hospitals are required to do these programs now, and the idea is that it's a minimum of 3 months, and sometimes they can be 6 months to a year. They promote teamwork, continued education, confidence, and commitment to the organization. Basically, it's a stepping stone in between nursing school and being on the floor. And I know from personal experience that it really benefits the new graduates. They feel like they have somebody that they can relate to, both in terms of another new graduate nurse as well as having a mentor system, which is invaluable as you become more independent on the floor. And like I said, as of 2014, all magnet hospitals are required to offer this program, and it's either in the form of a residency program or a fellowship program. Basically, the difference being, the residency program is the new graduate program, and the fellowship program is aimed towards developing specialties. So I personally was entered into a fellowship program for oncology, which I felt was extremely beneficial, and I highly recommend to anyone.
Do you have what it takes to achieve magnet status? There are many organizations striving to achieve this, but there are certain criteria you must meet before this status can be obtained. To begin with, high satisfaction and low turnover rates for nurses in the hospital is a must. 75% of nurses also must have their bachelor's degree. Generally, the fee requirement is $14,000 for every 100 beds. There are 4 phases that include this process. Phase 1, the application. Phase 2, submission of documentation. Phase 3, on-site visit. Phase 4, the appeal process.
Magnet recognition application. Earning magnet status requires that a hospital undergo a rigorous review process. First, hospitals must collect quality data as it applies to nursing. This data must be compared against the other hospitals for benchmarking purposes. Hospitals must collect evidence of nurse-sensitive outcomes, quality indicators on the unit, and compare them to a national benchmark for 2 years prior to application. Hospitals must also submit the relevant data to a national database for further comparison. Written documentation is submitted via application manual, which is purchased through the ANCC website.
Documentation demonstrating achievements in patient care, nurse satisfaction, quality improvement, and nursing research are submitted to the ANCC representatives when the data is collected. The magnet application process is completed with an intense visit by the ANCC representative who checked data matching and the organizational setting for nurses. I can recall being a nurse at Yale New Haven Hospital in New Haven, Connecticut when they were trying to apply for magnet status. The ANCC representatives went to the floors and asked nurses individually what their satisfaction rate was and their turnover rate, how long they were on the floor, and how long they planned on being on the floor. I'm proud to say that Yale New Haven Hospital is now magnet recognized. The final phase is the appeal process. Following the site visit, the Commission on Magnet reviews the completed appraisal report and votes whether to confer the magnet recognition. Once the Commission makes a decision, the healthcare system will be notified immediately. Now, a small amount of hospitals in the U.S. has achieved this status. It can be time-consuming, financially costing process that once achieved increases the patient and nurse satisfaction, and in my opinion, in the long run, pays for itself.
I am here today to tell you about the pros and cons of magnet designation. Magnet standards hold that nurses throughout the organization should perceive their voices are being heard, their input is valued, and their practice is supported. Magnet status can be used as a powerful recruiting tool for nurses because it is said to value nursing and promote excellence in care. Magnet status recognizes the quality of nursing, and there is said to be a magnet culture. Magnet culture is believed to create a dynamic and positive milieu for professional nurses that includes empowerment, pride, mentoring, nurturing, respect, integrity, and teamwork. Magnet status improves patient quality outcomes through a more educated workforce. Nurse turnover and vacancy rates in magnet hospitals was significantly lower when compared with non-magnet hospitals. Magnet status attracts high-quality physicians and specialists, and the RN turnover rate in non-magnet hospitals are 4.684 times higher due to staffing/workload and 1.439 times higher due to work scheduling. Achieving magnet status costs a lot of money that could be better spent on improving staffing conditions or on nursing salaries. All hospitals should be held accountable for providing safe staffing and a satisfactory work environment for nurses. Hospitals have reverted to short staffing and excluded nurses from decision-making processes soon after receiving magnet certification. Magnet hospitals do not necessarily have better working condition than a non-magnet hospital. Magnet status does not guarantee safe working conditions or safe nurse-to-patient ratios. The magnet status program does not follow all evidence-based practice. And nurses barely exist at top leadership levels like a board of trustees or other higher level jobs to have their voices heard.
By now, it is clear to see how effective leadership is vital to the success of any magnet program. According to the International Organization on Standardization, leadership is a key principle of quality management. This is because leaders are responsible for establishing unity of purpose by fostering employee engagement with organizational goals. Therefore, key benefits of high-quality leadership include motivating employees towards organizational mission and vision, minimizing miscommunications between organizational levels from bedside to boardroom, planning, implementing, and evaluating activities in a unified way, and fostering a healthy organizational culture. There are several important qualities to effective leadership within the nursing profession. The Magnet Recognition Program places a high value on transformational leadership. which has been shown to increase follower commitment and satisfaction, as well as organizational effectiveness. The primary activities involved in transformational leadership are creating a vision, providing meaningful work, building organizational trust, and fostering self-esteem and empowerment of employees. However, as we know, being a leader does not require a title. We must be the quality, the safety, and the improvement that we wish to see in the organizations we serve, for the betterment of our profession and our patients.